And I'd like to call the Health and Human Services Committee meeting to order. The first item on the agenda this morning is public comment. If you wish to speak, please come to the podium, state your name, and you may have 3 minutes to speak to the board. Would anyone like to make public comment?
Good morning, commissioners. I'd just like to take a moment to recognize the health department for the recent recognition that they received. It is, as I'm sure you all know, very important for people in a position such as that they have and many other health department employees or many other Ottawa County employees have, to make sure that the county is prepared for emergencies. And that's really what this recognition demonstrates. And so I just wanted to express as a resident of the county that I'm very appreciative that they took the time to do that. Their leadership took the time to do that, and all of the employees took the time to do that because it is an undertaking. And it also reflects well, I would say, on you as leaders, because you have a vested interest as well in making sure that the county is prepared for emergencies, for contingencies, for things that arise like that. And that's what that recognition is all about. So I just wanted to make that public statement this morning. Thank you.
Thank you.
Good morning. My name is Cynthia Madsen, and I'm here to publicly congratulate the Ottawa County Department of Health on being awarded a national honor for its ability to plan for, respond to, and recover from public health emergencies and disasters. It's an outstanding honor to be recognized as one of only 8 local health departments nationwide to receive this recognition. And as much as praise as we can give to those, it's also very disturbing and embarrassing that this current board has interfered with the workings of the Ottawa County Health Department, and they are trying to replace the current director, Mrs. Hamley. She has my total support in her legal battle against this Board of Commissioners. I believe that the board is misusing tax dollars to bully a nationally recognized health director, and I'm very hopeful that she will prevail in court and receive the monetary award that she is seeking. Her legal battle is an action against injustice. And as Martin Luther King said, injustice anywhere is a threat to justice everywhere. And this board's actions so far seem to be a playbook of injustice. And in my opinion, the actions and the behavior of the Ottawa County Board of Commissioners is a national embarrassment. Thank you.
Thank you. Anyone else?
Good morning. My name is Sheila Detloff, and I live in Holland Township. I would also like to thank the health department, particularly Lisa Stefanovsky, Adeline Hambley, and all the employees of the health department for this well-deserved national and state recognition. This was for their ability to plan for, respond to, and recover from public health emergencies and disasters. So I'm sure you're all as proud as I am of this department. It's one of, as she just said, it's one of only 8 in the nation being recognized for their emergency preparedness capabilities, which is extraordinary to me. And of course, this was not just for the COVID response, but was for the response to no fewer than 7 other actual or potential public health emergencies as well. The national award, as I understand, will be given at the 2023 Public Health Preparedness Summit in Atlanta next week. And now that the board's hands are no longer tied by the policy restricting resolutions, can I suggest that you recommend at the next full board meeting on April 27th that the board sign a resolution recognizing this extraordinary achievement? Whether you do that or not, I would like to note that many in the county have already recognized the excellence of our public health department. I have an envelope here full of cards and messages of appreciation for all of the dedicated employees at the health department. And then of course, there was also, as you've probably all seen, this front page story in the Holland Sentinel, above the fold even, so that was pretty cool. So basically, I just want to congratulate all of the health department employees for this recognition. Want to use my last few seconds to also mention the MCDC contract. I believe that the last public communication on that was that the legal counsel was working on it. my understanding is it's being upheld because of a concern about a non-discrimination clause in the contract that legal counsel believes does not comply or is not bound by Michigan law. I'm sure I'm not the only one who finds it a bit ironic that that's where you would draw the line as far as complying with Michigan law. But I would appreciate an update on the signing of that contract. Thank you.
Thank you.
Good morning. I'm not going to touch it. My name is Dave Barnowski, and my support for the community or for the public health department is well known and longstanding. But it's been 18 days since the Ottawa County attorney made false accusations in court, and I'm still yet to hear a public announcement decrying that statement. I also support the public health department. I want to thank them, give them appreciation for their award. I was dismayed to hear that after that announcement was put into the paper that Mr. Gibbs admonished their communications person and required that all future communications be approved by him. I don't know that to be a fact, but if it is, I would wish you would reverse that and let them communicate the truth, which I believe you campaigned on. I'd also like to bring up the idea and that ask you to please approve the community health needs assessment before the invoice comes due and Ottawa County is in breach of contract. You can't change the language of the questions they ask in that assessment, but you can't tarnish the image of the county and give us the image of being a poor partner. Thank you.
Thank you. Anyone else?
Hi, my name is Nancy Chowning, Polkton Township. I have communicated with several of, in fact, all of the commissioners. I've only gotten a response from 2 or 3, and none of them being Miss Miedema, who is my commissioner. So thank you for not ever responding to me. I've been in Florida for 3 months, but I have been actively watching these meetings every single day that we have been down there. And number one, I have been appalled at the actions of quite a number of the commissioners. But the reason I am here and the reason I will continue to be here is I am here in support of Adeline Hambley, the Ottawa County Public Health Department, Kendra Spanger, and the Department of Health and Human Services. I won't reiterate what the previous commenters have said, but I wholeheartedly agree with all of them in the fact that Ottawa County has been one of the 8 local health departments nationwide to earn this recognition. I'm also glad to see that you are all looking at me instead of having your heads down, as previous speakers have noted that I have noticed. Ms. Hambley continues to do her job and do it well, despite board members and the county administrator continuing to interfere with her ability to do her job after you demoted her to interim health officer this year. You wish to replace her with Nathaniel Kelly, who we don't know if he qualifies because, to my knowledge, as of today, his qualifications have not been sent to the State Department, or have they? And if they have not, why not? What's the holdup? What are you afraid of? Are you afraid he won't be approved? Health emergencies happen all the time, and we in the community must have good scientific information that is void of misinformation. Someone who embraces non-scientific treatments makes me worried about when other public health emergencies happen. What kind of information will we get? And yes, I am over 75, and yes, I have many health problems for which I have gotten all 4 of the things. So please make accurate information coming from the health department.
Thank you.
Hi, Megan Ryan from Holland Township. I'm here today to show my support for Adeline Hambley as our Administrative Health Officer. I admire her courage in accepting the role and fighting to keep it. I also want the board to know that I'm extremely grateful for every employee at the Health Department and CMH. They have been working hard to ensure the health and well-being of every county resident, and I want the board to know that I am appreciative of those efforts. I'm asking you to be supportive of them as well. I also want to recognize, as other commenters have, and as I hope this board will, the incredible achievements of the Health Department to receive a national award from Project Ready Health and Michigan's Health Policy Champion Award. The national award went to only 8 health departments across the country who demonstrated excellent abilities to plan for, respond to, and recover from public health emergencies, which are far more broad than just COVID responses. I'm so proud of these efforts, and I hope the employees who made them possible will be able to continue to serve their neighbors in this way. Finally, I want to share with the board an example of a wonderful health department employee. I won't embarrass her by mentioning her name, but I reached out to this person when I was upset about what I saw as a lack of necessary action. Though she couldn't resolve the issue at the time, she showed such care and compassion for me that I still felt understood and listened to. We have not met in person, but she feels like a friend because of the quality of the conversations we had. Her actions were a powerful example of responding in kindness, being willing to listen to where someone is coming from, and looking for ways to work together. I want to thank her again and make sure the board is aware of how helpful health department employees have been to me and my family. Thank you.
Thank you.
Good morning, Karen Obitz, Spring Lake Village. I won't repeat many of the things others have already spoken to about the award that the Public Health Department here in the county has received, but I do want to focus on one of the phrases in that media release that we have all been referring to. And that is the part about, I gotta find it. There you go, about how the department has received national recognition for its ability to plan for, respond to, and recover from public health emergencies and disasters. So that was the word that kind of jumped out at me there, recover. So I want to focus on the concept of recovery. So all of us in Ottawa County experienced the COVID emergency together. There was no avoiding that. It's the very nature of a pandemic, right? But the extent to which our pre-COVID sense of community has clearly splintered during the pandemic, and the fact that we seem to continue to struggle to fully recover as a community post-COVID grieves me. It seems that our county community bears deep scars resulting from the lack of a shared vision for how we could walk through the pandemic together without drawing up battle lines and sniping at each other or at the public health community members responsible for the well-being of all of us who live here. So I continue to hope that there is yet a way for us to move away from the COVID battlefield and move forward together to build a healthier community and a clearer sense of how we can be community for each other. To that end, I want to add here my gratitude to the entire Department of Public Health and assure all of them, as well as Chief Health Officer Adeline Hambley, of my continued support. But equally important to me is to express the hope that we as Ottawa County residents can aspire to the same untiring commitment to the health and safety of the community for which our health department has once again been recognized. Thanks.
Thank you. Anyone else? Okay. Next, we have the approval of the agenda. Is there a motion to approve the agenda?
So moved. Support.
So it's been moved and seconded. Is there any discussion? Seeing none, all those in favor of approving the agenda, please say yes.
Yes. Yes.
All opposed, say no. The agenda is approved. Moving on to our consent resolutions, we have one item, which is the approval of the proposed minutes from the March 21, 2023 Health and Human Services Committee meetings.
Madam Chair, I move approval of the proposed minutes from March 21st.
Okay, is there a second support? Okay, it's been moved and seconded to approve the consent resolutions. Is there any discussion? Seeing none, all those in favor of approving the consent resolutions, please say aye.
Aye.
All opposed, say no. The consent item is approved. So then, as we have no action items for this meeting, that moves us to our committee reports, where we will receive updates from several departments. And we'll begin with Adeline Hambley from the Public Health Department.
Morning.
Good morning.
I wanted to start with a brief update for the accreditation. And I've been in contact with Commissioner Brody and Commissioner Cosby. And then I had a chance to talk to John about it last week as well. Excuse me. Our site visits are scheduled for the state departments to come out and do that review the week of July 17. And so one of the things that we need to get to the state beforehand is a plan of organization. And I reviewed a little bit with John last week, and it's a bit kind of a boilerplate document. I believe I shared the previous accreditation cycle with this committee before, that has kind of what laws we operate under, and then a lot of dry information. It asks for like all the software systems that we use in our activities, whether it's the electronic medical record or even doing our permits, things like that. So they just kind of want an overview of how it operates. And so in the past, that has kind of worked through a contract ratification process because it requires Chair Moss's signature on it. And so we have to submit that to the state 60 days prior to the scheduled site visit. So right around May 18, I'll make sure that the draft is shared with this committee and then with John and Corporation Counsel, and then likely it'll be submitted through the ratification contract process, even though it's not a contract, but since it's kind of the same process for signature and review. So Chair Moss, you'll see it come through that way. So I would expect that in the next couple of weeks, and then I'll make sure that the committee has it as well. The other thing that I handed out, and I can send this as well in an email so you can click on things easier, is the county health rankings. So I believe I asked Commissioner Curran to hand it out since otherwise I had to like fold airplanes to get them all to you. So hopefully if y'all have one, this just recently was released, and what health rankings, they do it nationwide, and then Michigan counties are also included. So what they look at is health factors to represent community conditions that can be changed to improve the health and opportunities. And then they look at different things: health behaviors, clinical care, socioeconomic factors, and physical environment. And then they rank the counties by their health factor rank, with the top ranked county having the best health factor score. There's some information on that sheet. And for anybody that's watching or in the audience, it's countyhealthrankings.org. And you can click around and dive deeper into what exactly they looked at and what makes up those different things. And you can also select different counties to compare and contrast, not just in Michigan, but you can like select Ottawa and then pick any other county you'd like to compare to in the US. So the communities, we use them just as additional data to help guide, things that we might want to delve deeper into to get more information about what's happening or what's going on. You can find measures for overall health, which is the health outcomes of each county in the 50 states and District of Columbia. And they also include health factors, which is high school graduation rates, access to healthy foods, poverty, violence. The health factors help you sort of get a better idea of future health of communities, things that impact folks' health. This year's focus, they added civic health, so opportunities for people to participate in their communities. So civic infrastructure and civic participation were added as elements this year. So there are two categories for length of life and quality of life that determine the health outcome rank. And Ottawa County was number 3 of 83 for 2023. And then on this, the second page is just a summary of kind of highlights. You can again delve deeper on the website. Health outcomes, we were number 3, and those that represent how healthy a county is right now in terms of length of life, not just length of life, but quality of life. And health factors, we were number 2 in the state. So overall, we were 3. Health factors represent those things we can modify to improve the length and quality of life. And then the chart on the right gives you where our county health ranking was since they implemented this in 2011. Highlights, or I should add as a little footnote, there are data lags. So the most recent data used to determine this can be about 2 years old. So in 2023, Ottawa County ranked 3 of 83. So this year's ranking was the second time that we were below number 2. However, Ottawa County is the only county in Michigan that has ranked in the top 5 for health outcomes every year since this was implemented. And of the 33 measures, we were better than Michigan as a whole in 26 of them, which is 79%. And compared to top US performing counties, which is the top 90th percentile or 10th top quartile, sorry. Ottawa County is better in 12 of the 33 measures, which is 36%. Let's see, the percentage, our strengths, the percentage of live births with low birth weight has remained stable. It's lower than Michigan and meeting the target for top performing counties. Teen birth rates have continually declined, which has improved since 2010 and remain lower than Michigan and lower than top performing US counties. And then the percentage of adults with a 25 to 44 with some college reached a new high of 74% in 2023, which is the highest it's ever been. So a strength and an opportunity to explore, although higher, so worse than Michigan and top performing US counties, the ratio of residents to mental health providers in Ottawa County has consistently improved every year since 2014. So, and our opportunities to explore and improve, this first bullet point has kind of its own little footnote. So although it's improved over the last decade, air quality in Ottawa County continues to be ranked lower than other Michigan counties and a top US performing county. However, this is one that's a challenge for us to try and address. Our air quality has been shown to be impacted from air quality coming over the lake from Chicago, Indiana. So it's continually lower, but it's a hard one for us to actually address. I just put some other things that were kind of interesting. Adult obesity is elevated at 32%. We're better than Michigan, worse than top performing counties. The alcohol impaired driving deaths at 30%, which is, I thought was kind of surprising. So we're worse in both Michigan and top performing counties. Driving alone to work was 81% in 2023, which is slightly worse than Michigan and much worse than top performing counties in the US. That, of course, is unique to probably our landscape and rural, and we don't have trains and commuting like bigger cities. 2023 adult smoking remained elevated at 17%, but better than Michigan, worse than top counties. And then our ratio to residents to dentists, mental health providers, and primary care physicians, worse in Michigan and the top counties. However, as a footnote, although our ratio was worse, for some context, Ottawa is near Kent, which has substantial healthcare infrastructure. And this metric does not include physician assistants, nurse practitioners, and other providers. It just looks at doctors. And we have a very big network of MPs and MPAs. And it also doesn't account for primary care physicians that work in multiple counties, which with some of our big hospital partners is pretty common. So that is kind of a highlight. I encourage you to go and click around. It's got kind of a neat user interface that you can compare and dig into what this metric meant and what they looked at. So gives a nice overview. Does anybody have any questions?
Commissioner Cosby.
Just Wonderful information. Can you highlight, Adeline, some of the work that the health department is doing to help us with these outcomes? I know adult obesity has been on here for 10 years, for instance.
Yeah,
In that respect?
Yeah, there are various programs, I think, that touch on it. So even maternal infant health, they start when, women are pregnant and get on the program. And they work at nutrition and healthy eating, even at that level. And then that mom will stay on for the first year after the baby's born, and they will hit on that as well. It's not the primary focus, but it's a component of it. We have specific programs through the health education for encouraging activity. Some of them are in conjunction with our parks department. They have like Step It Up, encouraging. We will work with the parks to get people out to walk and do the parks. And at one, I'm not sure if they're doing it this year. In the past, they did. I think it was a golden shoe campaign. So if folks went and did these walking routes at every park, then you could be entered to win these prizes. So there's even in the Healthy Ottawa, like the food outreach program, they've been trying to expand with allowing benefits to be used at farmers markets for produce, increasing partnerships with farmers that have excess produce so they get fresh foods at food pantries. And then we ran into initially when that first ramped up that folks didn't know how to prepare or what to do with, like say there were eggplants, right? Provided that they would all just get passed up because folks didn't know what to do with it. So then they worked on providing like cooking demonstrations and recipes and things like that so that people could learn how to do that, or what to do with the fresh food. That's what's coming to me on the top of my head. I know for smoking, the county had a no smoking ordinance before the state adopted it to, prevent smoking indoors. They do campaigns to try to buy cigarettes see what places sell cigarettes for underage smokers. So they can follow up with that. I'm trying to think. That's kind of what's coming off the top of my head for obesity, and the air quality is a challenge. We haven't done a whole lot to address that. Let me see. I'm gonna look at my list. Yeah, that's what's coming to the top of my head for these specific lists. Of course, all of the programs are focusing on overall health outcomes, from permitting the wells and septics and restaurant inspections and outbreak investigation. There's death reviews, which is something that I luckily don't have to participate on personally, but they do review any suspicious deaths or any children. There's a team of the medical examiner and our medical director, and they review and look through what that cause was. They can see any trends and try and address that.
That's part of this information here.
The child death review or the death
Or
reviews.
just death review. I know there's a certain criteria that we report to who's the gentleman? Forgive me, the physician who's in charge of determining whether or not we do autopsies.
Yeah,
There's
the
different,
coroner.
State criteria.
Yeah.
Thank you. It wasn't coming. A question though, do we have like number of participants that we're tracking year over year for these, different initiatives? Because it sounds like we're doing some
Yes.
partnership, but it's not necessarily driven by the health department.
Some of them are, and we do. I just don't have them off the top of my head. I can put something together for you if you'd like, though, that's specific to these bullet points that have like participants and
Acknowledgement of
Yeah.
the good work that's being done where you see
Yeah,
trends
absolutely.
going in the right direction.
yeah,
Thank you, Adeline.
you're welcome.
All right, Commissioner Zylstra.
Yeah, thank you very much. Appreciate that. Yeah, I just want to, commend you and your staff for, consistently high ranking. This year we're third on this survey, and like you said, we've been top 5 since surveys come out. And like a lot of public commenters have said, the 2 awards for preparedness also. I want to commend you and your staff. So thank you for your work.
Thank you. Yeah, as a side on the preparedness, that was not specific for COVID response. It's over a 4-year period. Usually it's 3, but the timing was off because of COVID. But so some of the projects that were included in there were various outbreak response initiatives, including the PFAS at Robinson Elementary and the S-Tech and different things like that. It wasn't just for COVID, it wasn't COVID specific. So if anybody wants to know more about it, I'm sure a preparedness coordinator can fill you in on all of her programs. She does a great job. I do have, and I believe I sent this to Chair Rhodey and Commissioner Cosby for usually when we've come in the past, our medical director will come and just provide some highlights if there's emerging issues or just data or information or cases that we like to get on your radar. And so right now we're experiencing increase in GI illness this spring. And we're seeing it in increases in our complaints for foodborne illness. And never fails, like anytime someone's sick, they're certain it's the last thing they ate. So, but overall, there's an increase this spring. So she was going to come and kind of give you some updates or just a brief overview of what we're seeing. So, it's out in the community right now. And I don't believe that you've met her before. So our medical director, I'll call her up, is Dr. Unsinker. And she'll give you an overview of kind of what's happening right now.
Morning. I'm Dr. Gwen Unzicker. I'm the medical director at the health department. I've been here for just over 1.5 years. And before that, I've been practicing family medicine here in West Michigan since 2005 when I moved here to do my training. And it's been great. And so I wanted to talk a little bit about everyone's favorite topic, stomach bugs. So I'll try to be as delicate as possible. But you will see me from time to time when we notice that there may be certain patterns emerging with different kinds of sickness in the community. And again, I know nobody likes to talk about this, especially, right after breakfast, but we'll try to get through it together. So as part of our mission to work together to assure conditions that promote and protect health, the public health surveillance team that consists of employees from all different departments within the health department, and that might include environmental health, communicable disease in the clinic, epidemiology, administration. We all work together to monitor and investigate complaints of infectious diseases that are related to reportable germs, of which there are many. This is the list in very tiny print of all the different germs that are reportable to the health department, some of which are food and animal related, many of which are not. So we investigate any reported possible foodborne or animal related illness in Ottawa County. So sometimes that investigation might start with a community member reporting to us when they get sick, even if they're not sure if it's related to food or animal contact, or the report can come from a lab or healthcare provider. For example, if one of their tests comes back positive for one of these reportable germs, they'll report that to us, and then we contact the person who actually has the sickness, or we might become aware of it in many other ways, whether that's some of our state and federal partners, recalls, and we'll talk a little bit about that in a couple minutes. And then our team kind of divides up the work and weighs in from different perspectives. So our communicable disease team will weigh in and say, you know what, this germ doesn't usually cause these symptoms within that time frame. Our epidemiologists will say, well, if we look at this rate, this is probably most likely related to this germ. And it's kind of a really fun, from a nerdy perspective, a fun investigative process where we all kind of put our heads together and see if we can find a pattern and then get back to where that person may have gotten sick. And like Addie said, a lot of people just assume, oh, I got sick, it's probably that last thing I ate. But that's where we come in and we can help people figure out, was it the last thing you ate or was it something else? And then if it was something that you ate, is anyone else at risk from getting sick from that too? So this is kind of relevant this time of year because we're starting to enter the warmer months, more picnics, more barbecues. People are starting to cook outside away from refrigerators, may not have a meat thermometer handy. We're not next to the sink to wash our hands. So this will be just kind of a reminder of some food safety tips. Hand washing, if I can get one message through, it's going to be hand washing, hand washing, hand washing. I'm a little obsessed which is why my skin is very dry because I'm washing hands a lot. And we just had Easter. So some kiddos may have gotten some baby chicks in their Easter baskets. And those are so cute and lovable, but we need to be careful around those critters because they can spread germs. So how do the germs spread from animals to people? Direct contact, just like we said, petting our animals, hugging them, kissing them, those kinds of things, or even unfortunately getting scratches or bites from the animals can put us into direct contact with their fluids that may contain these germs. Indirect contact, so cleaning out the fish tank, cleaning out the chicken coop, even just being maybe in a pond or the water where some of the animals may have been. Spoiler alert, we'll talk a little bit about this in months to come, vector-borne diseases. So getting germs from a tick bite, a mosquito bite, those kind of things. Stay tuned. We'll talk about those as summer comes around. But we're really going to focus on the foodborne part of it. So every year, 1 in 6 Americans get sick from eating contaminated food. Eating or drinking something like unpasteurized milk, undercooked meat or eggs, raw fruits and vegetables that are contaminated with feces, infected animals can cause illness. So we want to really be careful whenever we're interacting with animals or using animal products, cooking, preparing foods, that kind of thing. We did see an increase in foodborne illness complaints over the last few months. So this is where some of that investigative team comes into play. We might be all communicating about a particular case and one of our team members might say, you know, really feels like we're seeing more of this particular bacteria come through the reports. And so then we can have our epidemiology team look at that and say, you know what, you're right. Or they might say, actually, we're about the same as we were this time last year. So what we have right now going on in our county from January to April of this year, we've had 33 complaints of foodborne illness. And at this same time last year, we had 32 complaints. So about the same as last year. So even though it might feel like everybody around you is puking, it's about the same as it was last year. But if we look back a couple of years ago, in 2021, we had 8 complaints around the same time frame. And in 2020, 19 complaints. So we think, well, what's the difference? Are people just getting more sick lately, or are we just hearing about it more? And we're not really sure which of those factors is at play here, but we're still looking at that. And the most important thing is we do want people to know they can contact us if they get sick, even if they're not sure what made them sick, so that we can all work together to detect it, treat it if possible, and then track down the cause so that we can prevent other people from getting sick. So the most common cause of foodborne illness is norovirus. And you've probably all heard about this. Anybody that has kids in school or the church nursery, we know that the norovirus spreads like wildfire, basically. So what can we do about it? Well, first of all, we have to try to avoid getting it, right? So the way norovirus spreads, again, I'll try to be delicate, is what we call the fecal oral route. So basically what that means is if you get tiny fecal particles, maybe on your hand or your fingers, you eat food or you touch your face or your mouth without washing your hands, it only takes a tiny, tiny amount of that virus to make you sick. Having direct contact with someone that has the virus can make you sick, or even eating something that someone who is sick has prepared for you can make you sick. So this is again where hand washing and food safety come into play. And the unfortunate thing is, you know, we've all got our little holsters with our Purell, right? Hand sanitizer doesn't work as well against norovirus. So hand washing with soap and water for at least 20 seconds is the best way to make sure you get that virus off of your hands. And that is the message that we keep trying to drive home. Hand washing, hand washing, hand washing. You're going to get so sick of hearing me say it. And then we have seen some other germs that cause foodborne illness lately, but again, norovirus right now seems to be what is in everyone's forefront of their mind, because we are seeing outbreaks, unfortunately, in some of our long-term care facilities where everyone is living in close quarters. And again, that just spreads and spreads and spreads. So again, if I could send home 2 messages today. Number 1, hand washing, of course. But then number 2 is, if you look at the health department website, there is a big red button that says report a concern. And we want people to report concerns to us. Even if it turns out to not be food related, we need to know about it, because then our team gets activated to track down, where did that sickness come from? Is there a pattern? Are other people getting sick from the same germ? Are they picking it up from the same place? And then we can really all work together again to help prevent other people from getting sick from that. You may have also heard about some food recalls lately. This is not technically within our jurisdiction in terms of determining the recalls, but we do work very closely with the agencies that do, and we monitor those recalls so that we can identify if somebody's calling us saying that they're sick. We can see, okay, did they eat any of those foods that were recalled? Our environmental health team, when they're doing restaurant inspection, can go to different licensed food establishments and say, hey, did they have any products that were part of this recall? So for example, just within the past week, Meijer and their supplier Revolution Farms had a recall of 12 different types of pre-made salads, which was very sad to me because they're so delicious, because they were contaminated potentially with an organism called Listeria. Listeria can be very, very dangerous for people who are very young, very old, or especially in pregnant moms. It can cause miscarriages, stillbirth, premature birth, and serious illness and death in newborns. Now, fortunately, as of yesterday, there hadn't been any illnesses reported associated with that. But again, it's just an example of how very important it is for us to constantly be aware of what's going on. And I think at the last board meeting, someone had been interested in knowing how you can subscribe to the FDA recall list. And if you go to the US Food and Drug Administration website, they do have a link, and I can send that link out in an email maybe, that one of our environmental specialists shared with me. So again, people who get sick, number one, wash their hands. Number two, let us know so that we can track it down. And then number three, if people are very, very sick. So I'm going to step out of my public health hat for a second and back into my family doctor hat. When my patients would call and say, oh, I've been puking for 2 days, I really need to come in, I got to make sure it's not food poisoning. I would say to them most of the time, well, there's not really much we're going to be able to do for you. So you probably don't want to drag your yucky, pukey self into our office and potentially spread it around. So just make sure you stay hydrated, get lots of rest. What else?
Wash your hands.
Wash your hands, exactly. And so that was me as a family doctor, just thinking about the person in front of me. Now, me as the public health doctor, I have to think about, okay, but does that one person sort of send a signal like, uh-oh, something's up. Maybe it's a restaurant, maybe it's a potluck, something like that. So that's why we want those folks to let us know when they're sick so that we can help track them down, even if it's not something that we can treat in the moment. But then since there are germs that can cause more severe illness, we also want everyone to be aware that people should contact their own healthcare provider if their symptoms are going on for longer than 2 or 3 days, if they have severe pain, if they're not able to keep fluids in, whether that's from above or below, if they're having high fevers, if they're seeing blood in their vomit or their feces, they need to be in touch with their healthcare provider right away. And then their healthcare provider can be in contact with us also if there's more investigation that needs to take place. And that's actually one of the ways that we found out about the E. coli outbreak last summer that ended up in a multi-state investigation, because a very astute doctor called in and said, hey, I have 3 patients right now in the hospital with this. You guys seen anything that might be connected? And then we ended up having a state and federal investigation of several states here in the Midwest. So it can be a big deal. And so we don't want anyone to ever think they're bothering us by telling us about their gross symptoms, because that's really how we keep everybody safe together. So there is your delightful update for today. Like I said, spoiler alert, next month, we'll probably talk a little bit about things like ticks and mosquitoes and the things that we have to look forward to as the summer heats up. But any questions or concerns that I can try to answer?
I have one.
I actually wanted to jump into the ticks for a second,
Mhm.
because I remember thinking about this a lot last summer. I believe the Ottawa Way newsletter had some statistics out about Lyme's disease.
Mhm.
And it was talking about the #1 diseases in the county. And I believe number 2 and 3 were STDs, but #1 was Lyme's disease.
It's really
And,
interesting. Yeah.
It was, it it struck me as this is
Mhm.
something that we should look deeper into. We're entering into spring. Are there things that we can do? Maybe this is an Addie question as well with, are we tracking where these ticks are more prominent? Are they in our parks, in our backyards, at our schools? Are there things that we could do to maybe treat these areas to get ahead of that, since it is so high on the list, number one last year,
Right.
and it seems to be rising, increasing?
Great question. And that is partly Addie's area as the former environmental health manager. But in terms of prevention is key. So yeah, there are going to be some of those environmental things, but then also individuals too. And we can talk a little bit more about this next time if we want to, but making sure you are checking yourself every time you come in from being outside. And that's like full body check, right?
Because if you pull that tick off your little furry friend or your child or yourself within the first hours,
Usually, so for Lyme disease, it
you'll
can be within
avoid
I
it.
think, 24 to 36 hours
Yes.
is how long it takes. So yeah, it's good, and I mean, one day last summer, my mom and I were just talking and I looked down and I was like, don't move. Just pulled the tick right off of her, but it hadn't been there long enough to cause a problem. So we can totally talk a little bit more detail about that next time. But in terms of what we're doing right now, as spring is springing.
Yeah, so we have a grant from the state to do surveillance. So we do a lot of tick drags, which again, I'm glad that this is not something I have to do. I feel bad for our summer interns. This is one of the college students' duties. So they have a big white sheet and then you have to like map off a square and then they have to drag that sheet through there. And then they have to pick the ticks off of it and they put them in a jar and then they sit at a microscope to like determine what species they are and count them. It's not, yeah, I do not envy them. I'm very thankful they come and help us do that. But so we usually will work with parks. We try to get along pathways at parks. Anytime you have mowed grass, this is the best thing people can do in the yard is keep their grass short. The dune grass, like our parks and the lot, like natural areas, you're going to have more of those. So if you take your dog out walking or running through the woods, you'll definitely want to make sure they have treatment and check them over too when you get home. But we do those tick drags to get an idea. And we have seen not surprisingly, as the Lyme disease rates have gone up, our ticks, the number of ticks that we find has also increased quite dramatically. So if people wear the bug spray, but wear long pants. I know nobody wants to wear long pants in the summer, but the lightweight hiking pants, if you can wear those with like socks over the bottom, again, like doing that check when you get home is really important. I can say, and we were just talking about this too, I think last week with John, they've seen looking for, part of the reason they're ramping up some of this surveillance is not just to see the number increase, but also because there are concerns with the Lone Star tick, which Lyme disease are the deer ticks. And so, black-legged ticks, which we have an abundance, but the Lone Star tick we've not really had. But there are some counties along the south border of Michigan that have seen it. And that tick will carry Rocky Mountain spotted fever, but also, I can't remember what the name of the bacteria is, but it causes allergy to red meat, like a lifetime allergy to red meat, which is a very strange and unusual symptom from a bite. But we had a couple of cases of Rocky Mountain spotted fever last year in the county, which had us very concerned, and we tracked it back. The family had been vacationing in Colorado, I believe. So the ticks weren't here, but it's something that we always watch out for. So yeah, I have bug spray. People should definitely use bug spray. We're hoping with this grant that from the state, some of it includes education outreach. So we're hoping to, in the past, we've partnered with parks and the state campgrounds and provided like packets of like DEET or off to provide to campers. So we're hoping that maybe we can roll something out like that this summer as well at our county parks. But I encourage people to definitely use spray.
Yeah, thank you for that update. I thought that really struck me as something that needs to be addressed and sounds like you're on top of it. So yeah, if there's more that we can do, let us know how we can, but keep pushing it out to social media, multiple pages through the county, because I think that's something that's very preventable. Like you said, in the first 24, 36 hours, just pulling a tick off will prevent the disease. Mowing the lawn, everybody can do that, right? These are very good steps. I'd also like to echo congratulations to your entire department, keeping the tradition alive of, keeping Ottawa County healthy. So thank you for that. Also, I've been monitoring the progress on the website. I know you've been working on that for a while now, Addie, since last year, getting rid of the dead links, correcting information, updating information. Looks like progress continues to be done there. Anything you'd like to talk about in relation to that?
No, we're still working through it. I don't have an update on the kind of the project management process that we're implementing, since we're still kind of testing it out. And I'm happy to bring it back, or if anybody really wants to come and see it. I think it's exciting, but not a lot of people necessarily do. But yeah, I think it's going well, and it's getting combined hand in hand with fixing that is updating the look a little bit too, which was kind of a nice side bonus, because some of it was a little bit dated. So
We've talked about putting more PDFs out there of, infographics, things that people can look at, and it communicates education to them. So I think that's positive versus linking to things that we don't control. And I think those are really great ideas. And it sounds like you're still working on creating some sort of an approval process and review process of what gets allowed onto the website.
Place, but we're in that everything flows through our anything that goes out to the public goes through our communications person, and then to either me or Dr. Unsiger or the deputy health officer to review. So nothing is being determined at a programmatic level, but the process for how we do that in an easier fashion is what we're trying to build. So
thank you very much. Thank you, Dr. Seeger. Yeah.
thank you. Anything else?
Hi, I appreciate the statistics. We've had a couple of years now of legalized marijuana. Is there just anything that you guys are seeing, at least relating to statistics, teen drug use? Has that been on the rise? Has that really not had any effect because of the legalization? Just curious.
I don't have anything off the top of my head but I don't know if you do, or for something we need to.
I would have to review. I know some of those statistics were in the youth assessment survey from last year, but I do know that our health education and promotion team works very hard on education for vaping, which might include marijuana as well as tobacco and nicotine products. And so they are working on some tremendous educational programs to try to increase awareness of the risks of those things. In terms of the statistics, that also may be a little bit tricky, since for some of it might be self-reported, and the teens may not be telling us about that, as you can imagine. So it's definitely something that's on the radar and something that is being worked on diligently from our health promotions team.
And I'm not sure. I know that they have relationships with the sheriff's office, and they might have a better handle of what they're seeing too in their duties. I just can't speak to them off the top of my head.
Thank you.
So. Anything else?
Well, I just want to say thank you for the reminder about chicks, having a dozen of them myself at home. So we will be washing our hands. Yes.
It's hard not to. They're so cute.
They are so cute. Yes. Yeah. And then Addie, I actually had some questions too about NACCHO and your involvement with NACCHO. Looking back, I see that Ottawa County has actually received a number of awards from NACCHO. We just received this one, and then in 2022, we received another award, which was for Model and Promising Practice Award winners. And Ottawa County received award for Partnering for Success Outreach to Achieve Health Equity. So that was a 22 award. And then in 2020, Ottawa County helped with making a video. They helped with some training that NACCHO did in regards to some drive-through clinics during COVID. And then even back in 2018, we had also received an award from NACCHO. And so it appears our relationship with NACCHO goes quite a ways back. And we also have a state branch of NACCHO, which is MELF. And so we are a member of both NACCHO and we're a member of MELF, as are all the counties in the state of Michigan. So can you just explain to us kind of what that relationship is like? What benefits do we get from being a member? What kinds of things do we do with each other?
So for NACCHO, I say NACCHO. I don't know if it's.
I don't know if I'm
correct
saying it
whether-
right.
So we do, so they're a nationwide association for city and county health officials. And so we do participate. They are kind of like a connecting branch for, they provide like that connection to federal agencies or even private agencies for related specifically to public health. And then and also to other counties, so we can share, or cities, because other states have health departments. So you can share model practices, which that one award that you were talking for 2022, each year you can submit, to this model practices award. And then they have a whole committee from people in public health at other nationwide that will review that. And if they feel like it's valuable to other health agencies, is kind of, they give you a whole criteria for how to judge it. But through NACCHO personally, I can say, so there are federal agencies that have to rank or have input from practitioners at the ground level that carry out programs, help them weigh in when they are ranking different. The one I sat on was for like radiation control program for, I believe it was the CDC, but they have like a radiation control program. And then they had these different initiatives that they could funnel their budget to. And so then there was a panel of local health and state and that sat on there and then weighed in on what was most important to us in those duties. And then, sorry.
There we go.
Oh my gosh, that was insane. So that would stop. So then they use it. It's just a portion. Like obviously we don't have a say to 100%, but they're required to get that input from practitioner level as a piece of determining how to use their funds. But most helpful is definitely the shared practices between. So if the drive-through clinic, for example, if you were there are cities that have, a population of 30,000 and 10 employees or whatever, and they need to do this, but they don't have the resources to determine how to, or they don't have like what we have with our sheriff's office or with Lou's program for EP, then they have some of those programs they can pull from to build theirs off of. They also do a lot of I'm so sorry. Yeah, it's so terrible. Okay. I'm not brief. They do a lot of training as well. So they have a national conference for preparedness it's not just public health, any sort of preparedness response like Lou's group might attend as well. And they'll go through different things of how to handle mass casualty events, or how do you do, they might have something on the drive-through clinic, or, just emerging. They'll have, since it's nationwide, they'll have for hurricane response or tornado response, things like that. Then they also have a public health trainings that are similar, and some of it applies, and it might be, we're seeing Rocky Mountain spotted fever and Lone Star tick just now starting to creep into Michigan, but other states have been dealing with it for a decade. So they have practices that we can take or borrow from. So that's pretty much how it's utilized. Same with mouth. So that's just a local or Michigan specific. So monthly, all the health officers meet, and then they go through we'll talk about different things, whether it's pending legislation that might impact us, like statewide sanitary code, or even kind of randoms. They'll watch to see, because they'll catch things that don't land on local. And for an example, just this week was one for an initiative to put in filtration in schools and daycares, filtered water bottle filters. But embedded in that bill was that local public health would do all the kinds of water sampling at those, which would be a challenge in multiple ways. But so they kind of alert stuff like that onto our radar too. But they also have organized smaller groups. So there's an environmental health directors forum that they'll meet and talk specifically about environmental health. I believe there's a medical directors forum. There's one for finance, because the billing is unusual and that they do medical billing, but then there's also grants. So just like the finance and accounting folks have their group to meet to talk about how to account for, how can they use these grant funds, and how do you do Medicaid billing, things like that. I don't know if that answer.
Yeah, yeah, it does. So one thing, I was looking a little bit more at NACCHO's site, or NACCHO. Do you say it NACCHO?
NACCHO, yeah.
NACCHO, at NACCHO's site. And I was looking at some of their policies. And so I guess, well, first of all, I would say, your awards are great in many respects. It definitely shows hard work and effort. And much of what is done there is great. I do get a little concerned when I look at some of their policies. And so I'm hopeful that we have independent thought that goes on a local level. So I'm just going to run through a few of these policies and highlight some things that I personally would like for our county to be watchful of. So one of their policies is on school and childcare immunization requirements. And NACCHO supports requirements that allow only medical exemptions due to allergy or medical contraindication. They advocate for policies that reduce or eliminate religious and philosophical exemptions. They want mandatory education sessions. And as you know, that right now is a requirement through administrative rule. But I would note that Ottawa County actually implemented that on a county level before it was even an administrative rule, and it was adding to the burden of law. And so I believe there might be some times when we're perhaps following some policy that's not appropriate. So we do need to be watchful of those things. Another policy that they have is on comprehensive adolescent health. And in it, they are wanting to educate providers, parents, and adolescents regarding minor consent laws that enable mature adolescents under the age of 18 to make informed decisions regarding their health care. And I know there are some laws related to that, but again, it's one of those subjects where we need to be very careful. On sexual health education, they advocate for comprehensive sexuality education, and that's radical sex ed that is being pushed into our schools. And I know from personal experience here in our county that our health department has been involved in advocating for that within our local school districts. Again, makes me wonder if that comes from alignment with NACCHO. They have a health equity and social justice policy. They have a climate change policy. They have a police violence and racism policy. And so just again, I just would encourage that we be careful about the training and the alignment that we do with them, that we're still thinking independently and consistent with the values of our community. So, but again, I do appreciate, you know, I do appreciate the recognition of the efforts certainly that have been put in by our emergency preparedness team and by the health department. But I think that we do need to be careful that when we're working on issues like COVID, which my understanding is part of the award was for that we're not overstepping. And definitely it's the opinion of many in our county, there has been overstepping over the last couple of years. So, anyone else?
Read this?
Yeah.
Sure. I have a letter that I'd like to read, and then I have an extra copy for the record. This is, and so I'm not sure if you're aware of this or not, but it is from Congress, from the Select Committee on the Coronavirus Pandemic. And so this was just sent March 28 to Lori Tremmel Freeman, who is the CEO of NACCHO in Washington, D.C. It's not very long because these pages are like half pages, and I'll summarize kind of the end. But I thought I'd read that because I think it's important. So, dear Ms. Freeman, the Select Subcommittee on the Coronavirus Pandemic is investigating potential political interference at the U.S. Centers for Disease Control. We are aware that the CDC sought input from NACCHO regarding the CDC's February 2021 COVID-19 school reopening guidance, titled Operational Strategy for K-12 Schools Through Phased Prevention, otherwise known as Operational Strategy. We are concerned about the potential for undue influence of non-governmental groups on CDC scientific guidance, and therefore request documents and information on your organization's knowledge of this matter. CDC permitted the American Federation of Teachers, the AFT, a political union, to revise and edit operational strategy prior to its release. The resulting published guidance advised keeping schools closed, contrary to the prevailing science, in greater than 90% of U.S. counties. The Select Subcommittee's previous investigation into this matter uncovered that, contrary to standard practice, the American Federation of Teachers was granted, quote, uncommon access to revise and edit an internal draft of the operational strategy at least 2 weeks prior to its release, even making line-by-line additions. These additions allowed the CDC to exert more control over school operations and advance the teachers' union's agenda to keep schools closed. The full extent and long-term consequences of the harm caused by the CDC's draconian school closures is not yet known. However, there is emerging evidence of substantial learning loss attributed to pandemic school closures. According to the 2022 National Assessment of Educational Progress Exam, known as the nation's report card, 9-year-olds lost the equivalent of 2 decades of educational progress in reading and math during the pandemic. Students who attended school mostly online for the 2020 to 2021 school year performed 13% lower in math and 8% lower in reading compared to students whose schools met mostly in person. Children and teenagers are experiencing a historic mental health crisis exacerbated by the COVID-19 pandemic. Social isolation and academic disruption made it difficult for teachers and child welfare workers to interact with students and recognize signs of child abuse and mental health concerns. Reports indicate that depression and anxiety symptoms for children globally doubled during the pandemic. 25% of youths are experiencing symptoms of depression. 20% are experiencing anxiety symptoms. Suicide is currently the second leading cause of death nationally for children aged 10 to 14. Pediatric physical health is also facing increased challenges in the aftermath of the pandemic. During pandemic lockdowns and virtual schooling, students' physical activity declined by 20% on average. This decline is on top of increasing childhood obesity rates in the US. This winter, young children are experiencing unprecedented incidents of respiratory illness, such as respiratory syncytial virus or RSV, and influenza due to the isolation from viruses during the pandemic lockdowns. Even as reliable data became evident, instead of prioritizing the health and education of America's children, the Biden administration prioritized its political allies. To assist the Select Committee in conducting oversight of political interference at the CDC, we request the following documents as soon as possible. And then it lists a few things. I'll just summarize. All documents and communication between NACCHO employees and the CDC. Documents and communications among NACCHO employees regarding operational strategy, versions of operational strategy in NACCHO's control, documents and communications planning between NACCHO and the CDC, and a complete list of the meetings that included employees from NACCHO and employees of the CDC and others. The Select Committee on the Coronavirus Pandemic is authorized to investigate the societal impact of decisions to close schools, how the decisions were made, and whether there is evidence of widespread learning loss or other negative effects as a result of these decisions, and executive branch policies, deliberations, decisions, activities, and internal and external communications related to the coronavirus pandemic. Thank you for your prompt attention to this matter. It's signed by Brad Wenstrup, Chairman of the Select Subcommittee on the Coronavirus Pandemic. And I have a copy to submit.
Thank you. All right, does anyone else have any questions?
I don't know if you can answer this question now, but since you're talking about that, is it the Rocky Mountain tick? So I know that people that get that, I think it's called that gala something, or I can't remember the name of the, oh yeah, alpha gal, I think is the name of the syndrome that they get. Now, when they say they're allergic to, if they get that syndrome, they become allergic to red meat. So what are in the category of red meat?
So it's basically non-poultry meat. So
Okay.
beef, lamb, pork, venison, I believe is in there. So basically like if it has 4 legs, you might end up being allergic to it. It's very sad. It was really like, again, from a nerdy standpoint, a very interesting story of how they discovered it. I heard the story of like one of the first patients that ended up with that particular allergy. And it was just a great example again of like public health and healthcare teams coming together to figure out, okay, what possibly could you have been exposed to that ended up having this outcome? So it's something we're learning a lot more about because it hasn't really been prominent until very recently. But yeah, it's unfortunately very sad for those that end up with it.
Yeah, how do they treat it?
Well, you just have to basically avoid the trigger, which is again, very, very difficult for some folks. So
Can they have anaphylactic shock to it too,
yes,
or?
yes. And so having an EpiPen handy in case you unknowingly consume something that can cause the reaction, but unfortunately the main treatment is avoidance.
Thank you.
All right, thank you. All right, next we have Kendra Spanger from the Department of Health and Human Services.
Good morning. I just want to give a couple of quick updates since I wasn't able to be here in March. First, I'm hoping that you all received my annual report that was sent out in March and didn't know if you had any questions. There's a lot of information and data about all of the services that we provide in there and statistics over about a 10-year time frame to provide some understanding and graphs that look at trends. But some stuff that happened since I was here last. First, as I mentioned in February, we did start the IVR, which is an auto phone call system for all those with assistance. And I just want to provide that phone number for everyone. So you've got that. So if someone is calling to ask questions about their assistance cases, food assistance, child daycare, state emergency relief, short-term disability, that phone number now is 844-464-3447. And that's now a statewide number. However, when individuals enter their zip code, it is then transferred to the county in which they reside. So for all of our zip codes, we have a call center that is open from 9 to 3. We in Ottawa have had a call center for a long time. We started that up on our own back 8 years ago. So it wasn't a whole lot of change for us, except for the time is a little bit shorter. We were open before 8 to 4, but now it's 9 to 3. The biggest benefit is that individuals can call 24 hours and it is an automated system. So there are some things that clients can receive without having to talk to someone related to things like if their application was received. So definitely some benefits to that program being initiated at the end of March. Also for Medicaid, as I came and presented before, Medicaid redeterminations are starting, and those will be happening starting in May. So letters will be sent out to those that have redeterminations in May. They'll be processed in June, and those that are no longer eligible based on criteria would be closed as of July for May redeterminations. And those will happen every single month moving forward. Next, on our child welfare side, I just wanted to say thank you to the county. As I'm sure many of you have seen, there's a lot of blue pinwheels throughout the county, and some of that includes on county property, including our office. And just want to say thank you for allowing us to plant those pinwheels, as April is Child Abuse Prevention Month. We have done some activities out in the community, in addition with the Children's Advocacy Center and the SCAN Council, which is the Stop Child Abuse and Neglect Council. We've been collaborating together for some events through the community, and just wanted to say thank you for the county's support to continue to do that annually. We just had our event actually April 12th and had some judges that came and presented, as well as the prosecutor's office, and it was a fantastic event. So thank you for that. And then just wanted to give you a heads up that May is Foster Parent Appreciation Month. So next month I will come with some data for you related to the number of foster homes that we have, not only just for our department, for the county as a whole. And I'll provide that as well. But if there are things that you would like to assist with Foster Parent Appreciation Month, please feel free to reach out to us, as without them, we would definitely have difficulties keeping our young kids in the community. So that's what I have. Didn't know if you had any questions.
Any questions? Go ahead. Thanks for being here today. Do you know what types of ways that, when you're saying to reach out and how to be involved, can you elaborate on that a little bit?
Yeah,
foster care?
so I know for our department, we are doing some certificates and going out to different foster homes directly to provide one-on-one appreciation. But some of the agencies are working together to put on other events. And so I don't have all the specifics, but I can definitely get those for you.
Thank you.
Yeah.
Kind of along those same lines, back in the day, I actually used to put together foster parent appreciation banquets.
Yes.
Yeah. So do you have any of those that go on during that month?
Yeah, that's a great question. We have been limited with our funds on being able to provide food during appreciation events.
Okay.
And as you know, that's a huge incentive to get people out, in addition to providing childcare so they can attend the events either with or without the children in their home. So we, at least for the department, put on one event because we're only allowed to do one with food per year. And according to our foster parent surveys, they appreciate an event at Michigan Adventure, which we do every year in August. So we push that back to August, but absolutely for many years, we would put on a huge event during Foster Parent Appreciation Month, but based on the surveys, they would rather be at Michigan Adventure. So we obviously are going to do what they ask. So, but yes, that's a great question.
Okay. Yes. Well, I don't blame them about Michigan Adventure. Yes. All right. Go ahead.
Thank you. First of all, thank you so much for your presentation today. I remember last time you were here, we had about we had a deficiency in foster homes here
Yes.
in the county.
Yep.
Has there been any updates on that as far as, I think we were short 4 or 5 homes for males, primarily like 11 to 18?
Yeah, so we still have those males not in our community. So the answer I guess would be no.
Okay.
Yeah, we are always looking for individuals that are willing to take teenagers or be willing to take them. So absolutely, that's still a need for us.
Okay, well, thank you, Kendra. I would take one, but we don't have any more room in our house. So if anybody out there would like to open their home, we would very much appreciate that. Yeah, thank you.
You're welcome.
Okay, anyone else? All right, thank you.
Thank you so much.
All right. And so we're done with our committee reports. So now is the second time for public comment. If anyone would like to make a comment, come on forward and you have 3 minutes.
I neglected to state it before, but my name is Dave Barnowski and I'm from Port Sheldon Township. I'd like to request specific references to anything that's not publicly available. Well, to everything that is publicly available, and copies of everything that isn't, for what you just used in your culture war attack or public launch against the public health officer. Everything you referenced on that launching of an investigation and pronounced whatever, all that nonsense that you just spewed about. I would like to know all of that. Everything all those little pages you turned and all those little quotes that you had, I would like to have all of that to try to refute everything, because you introduced it in a way where you don't defend what you propose, you just put it out there. Thank you.
I also would like a copy of that particular thing because I found it highly partisan. I don't know if it was a bipartisan report that was given, but as a former elementary teacher it was in Kent County, I know personally that whatever those kids, I was in the elementary school in 3rd grade for over 17 years in Comstock Park. Whatever those kids brought into school, into my classroom, I got. The rest of the class got. And of course, in a pandemic where millions of people died, you had to close schools. It was the only sane thing to do. But I would like a copy of that report so I can look at it myself to see how partisan it really was.
Thank you.
I just want to recognize that this whole last 15 minutes was set up from the very beginning when you asked questions about NACCHO, and you did that purposely so that Mr. Moss could then read his letter. So we're not fools sitting out here. We know that this was all orchestrated ahead of time so that you could get your 2 cents in worth about the pandemic.
Thank you.
Gail Rolas from Allendale. I want to commend the board for digging deep into what's going on. As a conservative person in this county, I appreciate that. And, I don't know Miss Hambley, I don't know the whole department, but I thank you for digging deep. I also know that in past meetings, questions have been asked by the board of Miss Hambley to find out who supported putting the different websites on the page. I don't know if the answers have been given to them. I've asked that in past times too. So I think we just need to be really transparent. So I just really appreciate everything that you're giving. Thank you.
Thank you.
Apologize for not telling you my name and location earlier. I'm Rebecca Patrick from Allendale. I was listening to the questions that the commissioners brought forward about the policy implications of being associated with NACCHO and MELF. And I guess my question is, we listened and were kind of surprised by a list of what are proclaimed to be policy problems with being associated with those two organizations. But my question is the health department doing anything that comports with those policy concerns right now? And if they're not, why are we having this discussion? And if they are, why are you not addressing it? And it seemed to me that the whole point of that diatribe was to discredit the award that was given to these folks by NACCHO, which was pretty poor public image, if you ask me. Thank you for your help. Yeah.
I think we need to request a check into our microphone system. Yeah. Patrick's on it. Okay, Patrick's on it. Okay.
Thank you for trying to exorcise it. Okay, that's helpful. I'd like to echo some of the comments just made about the comments made at the end of the Ottawa County Department of Public Health Committee report by Sylvia Rodia and Joe Moss. I like to just write down keywords. So I heard this from Commissioner Rhodey. Independent thought, overstepping, what? And values of our community. So I went online and I looked at what the values are of the NACCHO group, which in my mind is just a professional organization. And most professional organizations do have, and as far as I know from my background in education administration for a while, those organizations exist to support the endeavors of the organizations and the type of work that the member I'm having a hard time talking here. Sorry about that, but you kind of know what I mean. Professional organizations exist for a reason. And it seems to me that what NACCHO does is not out of step with what any occupations professional organization would do. But the values that I see listed on their website have to do with excellence and leadership and integrity. How is that not, I would hope, some of the shared values we would all espouse. So I want to be careful that we're not actually worrying too much about whose values that we're stepping on or whose thought processes aren't independent enough, unless we're thinking about the whole of the community, which is kind of what I tried to say earlier. So we all are going to have different perspectives. That's fine, but we don't always have to be so suspicious of anything that doesn't exactly align in the moment with our own particular point of view. So I, again, want to reiterate my gratitude to the Public Health Department and my desire that we stop sniping at each other, which I believed that was at the end. Thanks.
Thank you.
Lori Grassman, Robinson Township. I was gonna not speak, but I think we've heard for the past 3 months that we need to be transparent, correct? And I think that means everybody, that means the public health. So if we need to dive deep into NACCHO or NACCHO or whatever it's called, I think that that's appropriate. I think that it is commendable that we look not only here just at our county, but realizing that this was a national thing and it is now being investigated. And do we need to have a full connection to that? I would also like to add that when looking up NACCHO, I have found that it is a Democrat lobby group. So for an entity that continues to stand here and claim that they are not political and they don't take political sides, it appears that NACCHO is political. So I think we need to keep digging into the nonprofits that we're connected to. Thank you.
Thank you. Anyone else? All right. So that's the end of public comment. And as the adjournment is at the call of the chair, I call us adjourned. Thanks.